Hey everybody, this is Alfredo Castaneda from Heart and Health Coach. Happy to be alive, grateful, blessed. Today I wanted to speak about a little bit about Swan-Ganz catheters. Here it is. I've been reading a lot about this Swan-Ganz catheters in the different support groups that I am a member of and on Facebook pages. So I wanted to shed some light on all of these Swan-Ganz and the different ways of going about it, different positions, how best to live with it, and I guess in a way the best way to enjoy it when you have it in there. There's no way around it, so might as well enjoy it. So I am currently waiting for my second heart transplant and my first liver transplant. I had my first heart transplant in 2005 in UCLA, University of California in Los Angeles. And I am waiting, I've been waiting for about 67, 68 days here at Cedars-Sinai Medical Center in Los Angeles, California. I've had many of these swans installed at UCLA, at Kaiser LA, Kaiser San Diego. And not until I came here to Cedars-Sinai did I get the best experience in my life as to Swan-Ganz experience that I've had so far. So I came here and I figured out why. It turns out that Swan-Ganz catheters were invented here at Cedars-Sinai many years ago, almost 37 years ago, I believe, by two doctors, Dr. Swan and Dr. Ganz, or Dr. Ganz. They invented this to make it a little bit easier to, I guess, check on us congestive heart failure patients or just chronically ill heart patients. It turns out that it was a great idea, and because of these Swan-Ganses, many of us are still alive. Now, if you have a Swan-Ganz, it's pretty much basically for two reasons. One, they're trying to check the pressures on your heart or inside of your heart to see how well or how bad you're doing. That's one reason. The second reason is that you're waiting for a heart transplant. Normally what happens is that we need some medication called inotropes to keep our heart going until we receive the organ that we're waiting for, in this case a heart transplant. I'll try to show you without moving this too much. That is my equipment over there, and I am currently only in one inotrope, the last which is dobutamine. I am at 3 mics and 3 mics per kilogram per minute. Many years ago, 13 years ago, when I was waiting for my first heart transplant, I remember I was on at least 2 dobutamine and dopamine, as I remember, because my condition was very, very, let's say, worse than it is at this point. Yet I'm doing great. Give me 1 second, somebody's coming in. Sorry about that. That's one of my clinical partners, which are CNA, certified nurse assistants, and he's trying to clean everything in there. The reason I'm not wearing a shirt or a gown, which is right here, is because I just took my shower, which is pretty much cleaning yourself. That's one of the other things that you need to do when you have one of these swans, and you can't shower per se. So you have to clean yourself with a special sort of cleansing solution for you not to get any infections. So you can only pretty much towel yourself clean. And now that I'm in a bigger room, when I came in I was in a tiny little room, but now that I am in a bigger room, I am able to move around a little bit easier, and it has one of those handheld shower things. So now I'm able to wash the lower part of my body with that, and soap, of course. And so anyways, getting back to the Swan-Ganz. The second reason, as I said, is when you're waiting for a heart and you need the inotropes to keep your heart going. So once you have this in, pretty much depending on your condition, you either get checked 4 times a day or 2 times a day for what they call the numbers. They run your numbers. This means pretty much that they check again the pressures in your heart, and they come up with a bunch of different numbers that lets the doctors know how well or how bad you're doing. The goal is to keep you as stable as possible for the time being while you're waiting for a heart transplant. In my case, like I said, I'm waiting for a heart and a liver, but the way that you go about it is pretty much the same thing, because as the doctors say, the one that sets everything, the rhythm of everything is the heart transplant. Once I receive the heart transplant, then I can get a liver. In my case, it's going to be a combined, hopefully at the same time. But you can get a liver before you get a heart, because the heart is just going to kill it again. So it makes no sense at all. So that's the reason why mine is taking a little bit longer. I've been here 2 months, well, over 2 months, 68 days, I believe. And I still have a bit to go. They're telling me that I will at least be here for about 6 months, because I need the 2 organs, and I have a bunch of different things going on with my condition, you know, overall. So anyways, when I came in this time around, they were taking me 4 times a day for those numbers. And the best thing about having a Swan-Ganz catheter is that you don't have to be poked every 4 hours or so to get the blood drawn when they need blood also. You see this little port here? Let me show it to you. See that? And this is the ejectate, I believe. Oh yeah, ejectate. So they take the blood from here, so you don't have to be poked. See, my arms look great, although very thin. But you know, it is what it is. While I'm showing you this, this is the part, the syringe, is where they push water into your heart, cold water, colder than your core temperature. And they push this into your heart, directly into your heart via the Swan-Ganz catheter. And this is how they measure the pressures in your heart. They get those numbers that I was telling you about. They just call them numbers. So also here, you can see it, well, if I put it sideways here, they connect a tiny little thing that goes in there to check the core temperature of your body. So they check that through here also. Temperature of the water. Core temperature is taken through this one. So as you can see, there's a bunch of stuff held up by this contraption here that goes all the way into your heart. This is a pacemaker defibrillator. That's another story for another time. So yeah, this is where they get the core temperature of your body. So when I came in, they were checking me 4 times a day, also taking blood 4 times a day. As you begin to get stabilized, when I came in, I was doing very, very badly. Now I'm feeling a lot better because of the inotropes and being able to exercise, and they're taking the fluid via paracentesis every week and a half from my belly, because I retain a lot of fluid there because of the congestive heart failure, but also from the liver failure. So they used to be checking 4 times a day. Now that I'm very much stable, they only check it 2 times a day, which means it's a little bit less of a hassle, because it's very tiring to have to go through that every 4 hours. If you're taking a nap, you have to be woken up to do it. If it's 5:30 in the morning, you still have to wake up to do them now, and then I'm doing it 2 times a day, or 2 times every 24 hours. So it is a hassle, but it's even worse when you're doing it 4 times a day. So now they were taking blood samples. I'll show you another one. Blood samples from this one that I showed you, from this one here, and where's the other one? God, it's a mess. Well, imagine you see another one like this. And they take those two of these from those 2 different ports, because they on one of them they pretty much check everything, your blood, everything. They need to check CBCs and all of that. And the other one, they do the mixed venous is what they call it. They usually take a minute to take that blood out, because they don't want it to get too mixed with oxygen. So the results come back, weird. So they're doing that one when they take more than a minute to take it out. So the other thing that I wanted to mention is I've had many of these installed, like I said, in Kaiser Permanente, also at UCLA, but they've always been through the neck. You can actually see one of my scars here still from the last ones there. But when I came here, since I have so much scar tissue because of the many biopsies and Swan-Ganz catheters that I have installed, that I have had installed here, they decided to go through this area. So they call this a subclavian. Let me get close to the camera. Look at that, subclavian. So when you have the Swan-Ganz catheter in your neck, it kind of sticks up, like up to here. So it's very, very cumbersome and uncomfortable to move around with it. And you have to be very, very careful not to pull it out in a way or move too fast or do something weird with your movements. So it's very dangerous in a way to have it here, but also very uncomfortable if you're gonna have it for many, many months. So I also wanted to, I guess in a way, have you consider this as a possibility and put it out there for your doctors when they are ready to install it in your body. Have them do it in a subclavian way, like so, because it's way more comfortable. I am lifting weights, of course only 3 pounds, they don't allow me to do any more than that, but I'm feeling a lot better than I came in, a lot better than 13 years, well, 12 years ago when I started to feel ill for my first heart transplant. So I'm taking advantage of this. I'm exercising a lot, and one of those exercises, of course, is doing dumbbells. So I do a lot of dumbbells now, and the positioning here allows me to do a lot of movement, you know, as you can see. Freedom of movement, whereas when you have something here in the neck sticking out, you're worried about pulling it out. So this allows you a lot more movement. It's less painful, less cumbersome, less uncomfortable. So if there's it's interesting. So is there something that I could leave you with this video? Is pretty much that, to let you know that you need to try to get a subclavian Swan-Ganz like so, because it's a lot more comfortable. Now, the most important thing in regards to having a Swan-Ganz catheter for a long time, other than the fact that it needs to be comfortable and hopefully you can get it subclavian when you talk to your doctor before going into the cath lab, or if you're going to get it done in the hospital bed, because it happens sometimes like that too, depending on the hospital and the doctor, is to have a great seal around the entry wound or way into the heart, because most of the problems arise when you have some sort of infection around the area where they came in or they went in. So the theory many years ago was, or at least 5 years ago that I remember that they told me, is that these swans needed to be changed every 2 weeks, which is very, very painful after a while, because you feel very sore. So they pull it in, they pull it out, and as I believe it happened, they might correct me if I'm wrong if somebody comes in, but I'll tell you as I remember it. They're telling me that before, when people waited for a long time here to receive a heart transplant, like more than a month, more than 2 months, they would have their swan, and then after 2 weeks or 3 weeks, maybe at the most 4 weeks, they would switch it out. And then they would let them rest for almost a whole week, or maybe a couple of days, depending on the cath lab available appointments, I believe. My machines are going crazy, sorry. Because that way they would allow them to walk around for a little bit without the swan, and then they would get another swan and be bedridden, or at least room ridden, if there's such a thing, you know. But you were stuck to your room, and that's all you could do. But things changed a couple of years ago, and they decided that, first of all, if the site looks clean and there's no infection, and the wound is, the wound area is properly sealed and closed with the bandages around it, and again, there's no infection, there's no need to switch it. And this means you can keep it for many, many months. So, and the second thing that's great to me, because now I'm able to enjoy this on a daily basis, is that now they take us out for walks. We can't leave the unit. I was going to say the floor, but kind of roam around the floor. But you can't leave the unit. and you go around. They have like it's a pretty big unit, so you walk around here as much as you can, or as much as they can allow you to, and it's very, very nice to do that and not be holed up in the room 24 hours a day, you know. So that's the other reason why I recommend getting a subclavian. Sorry, I keep looking at this. Subclavian Swan-Ganz catheter, because it's much more comfortable when you're walking with it, and the way that it's installed here, as you might say, it's easier for the seal around it not to come off so easily, because when you have it here in your neck or on your neck, it's actually in your neck. When you move around, every time you move around like so, it tends to peel off little by little. And I'm telling you this because I had this, they used it for a treatment of plasmapheresis. Now it's a lot better, but hold on. Alfredo? Okay, sorry about that. Just to remind you guys, I am in the hospital while I'm filming this. There's people coming in all the time here. Volunteers, nurses, doctors, everybody. So it's very hard to film anything nowadays. But I still keep trying, still keep working, and I still try to make a difference. Okay, so what I wanted to show you now, I told you what the reason is behind trying to get this here. The other reason is, and why I thought about doing this, making this video, is because one of the group chats that I was in the other day, a lady had a condition with hers that they kept changing it every week or so. In a week, she had to change like 3 times. Because she had it in the neck, or in the neck, and it kept opening around there, and she kept getting these infections. So they would switch it out every time she had an infection, and she was very tired. She's in the hospital. She's afraid, and going through this is not fun. So I recommended her getting this, and I said, I mean, there's many of us waiting for a heart. There's many of us fighting chronic heart disease that are going to have one of these maybe in the next couple of months or whenever it is, and it would be nice for somebody to tell you what the experience or what my experience so far has been with it. So it is very cumbersome to walk around with this. I'll try to show you as much as possible what I'm talking about, but let me stand up so I can show you what I'm holding onto all the time. So of course you have to be, well, let me get this closer. I am monitored 24 hours a day, of course, and my bed is on that side. I'll show you right now, but my bed is on that side. I'm in a pretty big room now. I came in and I had a tiny little room, but now it's a lot better. I can move around. And then again, I'm feeling a lot better, so they allow me to move around a little bit more than they usually do with the Swan-Ganz patients. They allow me to go to the restroom by myself and do a lot of things by myself because I am more stable now. So you do have to carry around all this with you. Of course, you have all these cables stuck to your body, which is normal when you're hospitalized. But these are the ones that come with the Swan-Ganz, as you can see. So this comes out to here, and this helps a lot because it holds most of the weight of all the stuff that you're carrying with it, which is all of this, all these cables. This is the introducer, which they call the TKO2, and like it says, it has normal saline running through it 24/7. This is the, okay, I can't read that, but it's infusion something there. Yeah. And this has the inotrope, which is the dobutamine. This one here is for an extra infusion. I think they only have oh no, they're running magnesium on this one, repleting magnesium and stuff like that through this one, but they also use this one a lot of the time. Okay. Sorry, another person came in. I'm back. Okay. So, and this is the one that I was telling you about, where they push the saline solution to check what they call the numbers or the pressures in the heart. And they also use this one, which is connected to the same thing, to get any blood draws that they need to. And this is the site that I was telling you, where they check the temperature of the water that they're pushing into your heart. This is the one that I was telling you, where they check the core temperature of your body. So this is used a lot. A lot of people lose these little caps, so it's important that you keep it in there, because there's some prongs in there, as you can see. So if you lose it, they might bend or something, and then you would need to get a new Swan. Anything that breaks in these, anything that happens to especially this part and up, you would have to forcibly get a new one. So yeah, you have to go into the cath lab again and do the whole thing. Now this syringe here, you can see it here. This syringe is rarely used by anybody except for the physicians, usually the cardiologist only. So this syringe is usually not touched by anybody, and I think it mainly has to do with fixing the way that the Swan is set in there. If it touches like a wall of the heart or something and it starts showing like weird waves, then they use this to fix it. So this is the, there's my bed over there that I told you I was going to show you. So I carry this around with me all the time. My machine and everything. You might be familiar with this if you've been waiting for a heart or suffering with any type of chronic heart condition or disease, you know. This over here is what they inject the water with to check the levels of your heart, or the pressures in your heart. So this is what gives them a wave on the machine up there. This one over here. And these, of course, are my different fluids that I'm getting on a daily basis. So yeah, if you go out for a walk, you go out for a walk with all of this. You go to the restroom, you go to the restroom with all of this, and it's really fun. So yeah, that's what a Swan-Ganz catheter looks like. This is what a subclavian Swan-Ganz looks like. I recommend it. I recommend it far more than the neck one. So if you're going in for a Swan-Ganz, or you're exchanging the one that you have because you had an infection or something, ask for a Swan-Ganz that is installed, as you might say, in a subclavian form or way. A lot more comfortable. You can move around in it, and it's not painful at all. So yeah, if you have any questions, post them down there. If you have any points of view also that could help me while I'm waiting here, that would also be great. And thank you for listening. Okay, another person came in, I'm sorry. Okay, well, thank you very much, guys. Like I said, any messages, any questions, please let me know, and I'll make sure to answer them. You have a wonderful day. Thank you for listening. Thank you for viewing, and I'll see you next time.